Hi, I'm Dr. Ange Mack, and I'm here to bring you part 3 of my 3-part story, originating when I was diagnosed with ALS in January 2023, so over 2 years now. And the first 2 parts, if you haven't seen them yet, revolve around everything and my symptoms and health conditions leading up to ALS diagnosis, so 10 to 15 years prior with the heart conditions. I go into all of that. And part 2 really goes into over 22 specialists that I saw when we were trying to figure out, once I realized I didn't have ALS, what was it that was going on, because I felt like almost every organ system was impacted in my body. And I go into great detail as to what that looked like, what I went through, the specialists I saw. In addition to parts 1 and 2, I also did a presentation recently where I have PowerPoints that really kind of spells out all the different specialists, all the diagnoses, all the symptoms, and it gives you a nice visual so you can go back and find that one. It's me on a Harley. If you haven't seen it yet, that's the intro picture. But today I'm going to focus on a couple of different areas. One, the things that impacted me the most, the health problems that really just laid me out and were the hardest. And I had about, again, 22, 23 different symptoms that I was dealing with and problems. And the second part we're going to talk about today is specifically around those health conditions that I didn't know were happening, those insidious health conditions, which aren't really apparent, like a hot flash or a night sweat. And these were all due to the diminishing hormones from everything that I've assessed and my doctors to date have assessed. Oh, and I am wearing my Proud Veteran t-shirt today because it is Veterans Day. What is it, November 11th, 2025. So here to celebrate and thank our veterans. Many of you know I run a Veterans Association as well, a nonprofit to this consulting work. So yay for our veterans, and we thank them for their service and their sacrifice. So moving right along, we're going to focus in those 2 areas, the symptoms that really impacted me the most and symptoms that were very insidious, and not all of them I'm going to highlight here for you, and then share a couple of them, real life, real ridiculous doctor stories. Sorry, doctors. I mean, I love my doctors out there, but some of you just need to be educated. Most of you have no idea what you don't know, and with the FDA passing of new regulations, getting rid of many of our unnecessary black box warnings on some of these menopause and low hormone therapies, with this just as of, I believe, yesterday or this morning, the FDA announced that they're removing these. So we are making huge strides, and the doctors, I believe, are starting to get the message that hormones are not causing the blood clots and the cancers and the strokes and everything. The Women's Health Initiative in 2002 allegedly said that they did. So all of that has been relooked at with that research and reassessed, taking out what's relevant and what was helpful and what's not. So we're really happy about the FDA's new black box warning removal, and I believe that will help our doctors. But still, there are stories, right, ladies? We have so many stories, and sadly, we can't undo those, but hopefully going forward we can learn more from my work, from the work and the education that you're going to get to help yourself regain this agency in the doctor's room and take back control of our health if we haven't already. So to start with, one of my largest issues was, we call it brain fog. I think when you're talking with your doctor, it's brain fog, but it was more than brain fog for me. It was debilitating. As the CEO of Nova Veterans, I was giving multiple speeches and presentations, many things right off the cuff, and I found myself not being able to carry out a logical sentence. I couldn't think of words. I would go to say a word, I would say the wrong word. My brain was not only foggy, it wasn't working. The synapses were not firing, and it was driving me crazy. I couldn't add, I couldn't think right, I couldn't speak well. And what did I do because of all of this? Well, I always look at the nutrition side of things. Am I not eating enough protein? Am I having too much caffeine? And I was having maybe a cup a day. I'm down to like half decaf now or half calf now, just 1 cup. But back then I'm like, what am I doing? Am I not drinking enough water? Of course, we're kind of always like looking at ourselves, like, what am I doing wrong? What could I be doing differently? And sometimes there are things, but sometimes it's just diminished hormones. And that's what we realized. However, not before going to multiple providers, to include a psychologist, where I received cognitive testing, and it was confirmed that I had a cognitive disorder, which, I could have told them that, but I had to do a lot of tests and word tests and memory tests, and they said my working memory was off, and also my word generation was off. And again, things that I knew, but in a way it felt good to be confirmed, like this isn't all in my head. These are actual things that are happening inside my brain that I had no control of at the time. So again, one of the number one biggest things, even above all the pain I was feeling and the muscle spasms and all the other problems, that memory and that ability to speak and add and think and just be myself and be witty. I had no wit. My wit was gone. I could not even go off the cuff and, say some of the funny things that my family and friends are used to, dealing with, but love about me, I hope. So anyway, my wit was gone, and my thinking ability and speaking ability was gone, and I was quitting jobs and work, and I was doing multiple things, to include teaching at George Washington University at the time. I could not continue doing that. I was working in the integrative medicine department there, and I had to step down. So all of those things just impacted me so much, and I just had to stop. I had to stop many of the things I was doing. The second biggest thing that hit me hard was the debilitating fatigue, and this was crazy for a woman who's used to, getting up at, 4:30 and doing hot yoga at 5 and, going to the gym after that possibly, and then hitting the ground running with my multiple jobs and multiple work and just nonstop energy. I went from that to not being able to hardly get out of bed in the morning some mornings, or I would get up, maybe have an hour where I felt my brain was working enough, and then I was on the couch trying to answer emails on my phone and correspond and keep things running and afloat as much as possible. So the fatigue was unreal, and I'm letting you all know these things because I feel as women, many of us, so used to just pushing through. Yes, I'm tired. Yes, I'm not sleeping well. Yes, I have these pains and problems, but the day has to go on. I still have to take care of the kids. I still have to take care of my family, have to do the work, got to pay the bills, whatever it is that you have to do. We're just used to pushing through. And I just felt like an absolute failure because I could not push through. I could not push through this, and it was driving me nuts. The third biggest problem I was feeling were the muscle spasms. So my triceps were spasming, my forearms were spasming, and it just, I would go to move my back would spasm, you'd stretch your leg, that would spasm. Just that the pain in my muscles and the spasms really took a toll on me as well. I was afraid to move. I would try to do like an easy yoga, and any little stretch would put me into a spasm. And again, during all this time, I was seeing multiple doctors. I was trying multiple supplements to include magnesium and creatine and vitamin D with MK7 and just a number of things, working with my integrative medicine doctor at the time, who was boarded in functional or certified in functional medicine, boarded in integrative medicine. So I was trying to go down every possible path to find what would heal me. And boy, oh boy, was I was racking up the bills for sure. Supplements are not cheap. Out-of-pocket healthcare providers are not cheap, but my health was worth it 100%. I had to figure this out. The muscle pains, joint spasms, horrible. The fourth biggest issue, and this kind of goes along with the muscle pains, it was joint pain. So my elbow joints hurt, my knee joints. I couldn't walk well. They would just randomly swell up, which was bizarre. So, these types of issues sent me again to a rheumatologist, to orthopedics, to pain doctors, to acupuncturists, like so many. It's like, why are these joints hurting me so badly? Why are they swelling up? And I will say an underlying cause, and if you all have been looking into nutrition and well-being and integrative health, which I've been doing for 20 plus years, you'll know that inflammation is the cause. But what causes inflammation, right? If your body is inflamed, it'll impact so many different organ systems in yourself. So we want to figure out what's causing the inflammation. Is it food? Is it something in the air, like an environmental toxin of some sort, something that we're drinking, molds? I mean, there could be a lot of things that assault our body and we're just not even aware of it. So reducing the inflammation and finding out what causes your body to become inflamed, that's the key. So that was my number one focus, is like, how can I reduce my toxic load? How could I reduce the inflammation? And that's still a big focus of mine. So those are the four biggest ones that I felt day in and day out. Again, I had like 23 symptoms on health conditions, but I would say the things that really impacted my quality of life and how I felt day in, day out were the brain not working. I won't even call it brain fog. It's not a fog. It's like a darkness. It was just, I mean, if you guys are feeling into this, any of these types of things, let me know what you're going through, because it is just unreal. Debilitating fatigue, just done. Like I would have maybe spurts of energy and then I was just done. Couldn't get off the couch, couldn't get out of bed. That was horrible. The muscle spasms, again, and I still have some, not to the degree, but some of these things are still going on, even though I've been on hormone replacement therapy for over a year now. It started September 2024, it's November 2025, but my improvements across the board just overwhelmingly positive. I couldn't be happier at this point compared to where I was in January 2023 when they misdiagnosed me with ALS. So I'm happy with my results. However, I'm going to get even better. So now I'm going to dive into some areas that I didn't feel, that were not evident. And these are the things that I really want women to think about when they're assessing themselves, maybe in their late 30s or 40s, and they're like, oh, I'm not having hot flashes, I'm not having night sweats, I'm feeling pretty good overall. But the things that we can't see or don't feel, that all of us experience, all of us women experience, if we haven't had surgical menopause, if we're 35 on, we start losing estrogen, progesterone, and testosterone. All of those are produced in the ovaries. Testosterone is also produced in the adrenals as well. So we are losing these hormones because we are losing eggs that are coming from our ovaries. And because we're losing these, it's impacting every organ system in our body. So the number one thing I'm asking women to get is a DEXA scan to start with. There's multiple things, but I would say baseline, get a DEXA bone density scan, and it takes maybe 5-10 minutes, low level radiation. You go in, you get some bones x-rayed to see what their density is, and after that, after you know what your bone density is, you can better predict. Let's say you're 35, you get a bone density scan, a DEXA scan, then in 10 years, let's say you get another one to make sure your bones are still strong. They're still where they are, because we want to make sure that our depleting hormones are not in conjunction, diminishing our bone strength and our bone density. So how do we prevent that naturally? Lift weights, plyometrics, which are types of jumping that puts impact on your bones. So lifting weights, plyometrics, eating enough nutrition, hydrating well, all of these things are going to keep your bones strong, and you got to start it. This is nothing you want to start, after you've been diagnosed with osteoporosis, where your bones are very not dense. They lose their density to a point where it's a disease state called osteoporosis. You don't want to get there and try to reverse it, because that's what I had to do. So the number one insidious health disease that I got during perimenopause, when the hormones were dropping, was osteoporosis. Had no idea. I've been weightlifting since I was 14. I've been jogging, doing triathlons my whole life, and plyometrics, and doing different pounding exercises and box jumps, all the things I was doing. And in January 2023, I was diagnosed with ALS because I had all of these problems going on. A few months later, I had a DEXA scan, because they wait till you're in menopause to give you a DEXA scan after you've had 10 to 15 years of gradual to precipitous bone loss, and then the insurance covers a DEXA scan. And at that point, I already had osteoporosis. If I would have known 10, 15 years ago that this was even a possibility, I probably would have gotten on hormones back then, as if I realized my hormones were low. So I would have had all the blood draws and the tests, and I would have followed and made sure I was giving my body what it was losing. So number one, osteoporosis. You're not going to feel it until you break a bone, and you don't want to let it go that long. Get a DEXA scan, ladies, please. You can get one, I think, for $100 if you have to pay out of pocket. That was my last quote that I received, even though my insurance, I kind of want to get the information for you all. If your doctor says that they don't cover it, or you're strong, I've had women come to me, friends, oh, my doctor says I'm strong and healthy, and there's no way I could have osteoporosis. I'm like, yeah, that's exactly what I used to think. But that was not the case. And no matter how much I lifted and how strong I was still losing the hormones, and I was still losing bone density. So just because you may be feeling good doesn't mean these things can't creep up and borderline make your life miserable and potentially kill you way down the road if you do have a hip fracture or a bone break. So get the DEXA scan. The second biggest issue that I had that I didn't realize was going on was that my blood pressure was getting higher and my cholesterol was getting higher over the years. And I was, like we all do, we go in for a physical, we get the standard lab work, and we get our blood pressure taken when we're at our doctor's office. And past 5-6 years, my blood pressure was slowly going up. Had no idea why, just figured I was Russian that day. But it was a trend, and it was a trend that didn't reverse until recently. And in addition to my blood pressure, my cholesterol was rising without any change in diet or exercise. And I was really baffled by the cholesterol and what I learned. And I learned so many things as I did deep dives and research into all of these issues I was having and what causes them and what I could do to reverse or prevent them from getting worse. The ideal, right, is to reverse the osteoporosis, is to reverse the high blood pressure and the high cholesterol. I didn't realize that my cholesterol was getting higher because my estrogen was getting lower. So cholesterol is the precursor for these hormones: testosterone, estrogen, and progesterone. Many people don't realize that you need cholesterol. It's not a bad guy. It's only when we get too much that it can become a problem. But we need a certain level of cholesterol. And as my estrogen was dropping, my body was like, the cholesterol was like, oh, we need to make more cholesterol to make more estrogen. But that wasn't happening because my eggs were going away. So it was, my brain was getting the wrong signal. It was increasing the cholesterol to make more estrogen, but I couldn't make more estrogen. So there was a lot of, that's why we feel so crazy with regards to just our energy and our mood and how we're feeling day to day during perimenopause, because our hormones are like this. Our brain is saying one thing, our body is doing something else. So that cholesterol will naturally go up as your estrogen is lost. And I didn't realize that. And probably until about 2 years ago when I was researching this, I didn't even realize cholesterol was the precursor to these hormones. So again, I've become an expert in many areas over the past 2 years to save myself, and now to hopefully save and help so many other women out there that could be going through or potentially going through many of these things. So the cholesterol and the high blood pressure, now you know if you want your cholesterol to go down, it may not be just a factor of eating lower saturated foods. You may need some kind of hormone therapy to help that. And again, it doesn't matter what you choose. I just want to make sure you're informed. I want to make sure all the women are informed and they're educated and they know what their options are. So high cholesterol, many girlfriends have reported back to me the same. Their cholesterol has dropped, and sometimes significantly by 100 points. Their total cholesterol and their LDL significantly as well, to back into low to great ranges. So it's doable, it's real, the information's out there. The other big insidious type of problem I had was an autoimmune condition that kind of smacked me from out of the blue. One of the things, many things that I've realized and researched and discovered was that autoimmune conditions are increased when a woman starts to go through perimenopause and starts to lose these hormones. So if you have an autoimmune condition, it could be lupus. I mean, there are so many, mixed connective tissue disorder, which is what I have. If you have something, it could get worse. It could get exacerbated with the loss of hormones. If you never had anything and then all of a sudden you're getting weird rashes and you're having all of these bizarre symptoms, you may want to go in and get a rheumatoid panel, an autoimmune panel, to look at certain autoimmune markers, which is what I ended up doing eventually, again, on my quest to figure out what the heck was going on with me. We realized it wasn't ALS, but I was still having so many horrible symptoms. So if you're having a lot of weird symptoms, it may behoove you to go and get an autoimmune panel to see if you have any of these markers. There's ANA markers and many other blood markers that you can look at to see if maybe there's something going on. And it could be a different treatment. Again, there were many specialists wanting me to get on many medications. I did not want to be a polypharmacy. I didn't want to take multiple drugs. I just wanted to figure out what was going on. And then if I needed to, after I've exhausted all nutrition and natural and lifestyle therapies and changes, then yes, maybe. But it was never my intent ever in this integrative health industry to become polypharmacy and take a statin to lower my cholesterol, or get on a reclass type of drug to stop my osteoporosis, because the negative impacts from these pharmaceuticals to me were worse than the disease and taking the time it would take to reverse them. So yes, mixed connective tissue disorder, which I still have the markers for, but I am confident that I will reverse this as well. So just watch that space and tune in, and hopefully I can give you updates, or I will give you updates. If you're here, you'll hear it. And if you're having similar issues, let me know, because it helps for other women to hear your stories too. I've talked to girlfriends that I've supported 100% in their perimenopause and menopause journey and getting on hormones. And that was their choice. I gave them all the information and talked with them about their health condition, the medication supplements that they were on, all the things you need to do before you make the decision to get on any kind of hormone therapy. And it was the best decision for them. But some of them are still just very reluctant to share with their women friends and family. And I don't want perimenopause or menopause to be a bad word. I want you guys to use it and talk about it amongst your girlfriends, and not just, commiserate about the no sleep or the feeling horrible or the brain fog. I don't want us to commiserate. I want us to understand what's going on and find ways and solutions to fix these things, because many of them are fixable. And if you haven't learned anything from these last three parts to my big story, a lot of this is reversible. And if I can do it, you can do it too. So those were the biggest issues I saw that snuck up on me: the osteoporosis, low bone density, the high blood pressure and high cholesterol, both of which I've reversed, and the autoimmune mixed connective tissue disorder. So those were the three biggies. I will say sarcopenia and muscle loss. I wouldn't say that I felt that I was losing it. I felt weak. and I saw that I was losing muscle. But since I've been on the hormone therapy, and to be transparent and to let you guys know, I'm on an estradiol patch. I started at the lowest dose and I'm up to 0.75. I'll probably increase a little bit more based on some labs and information and how I'm feeling. I'm on progesterone, micronized progesterone. All of these are bioidentical. So I'm on those two, and I'm also on a little bit of testosterone, which comes in a gel, because they have not yet made dosage packages for women, but I see that changing real soon, especially with the new FDA regulation and taking off those black box warnings where they're not needed and never justified. So those are the 3 hormones I'm on. I've tested, just about every blood panel you can imagine I've looked at for myself. I've had multiple CTs, which are scans of the body, multiple ultrasounds, x-rays, MRIs. I think I've looked at every vein, muscle, structure, tissue in my body. I had a muscle biopsy here because of all the spasms. They were trying to find out if I had diseased muscle, so I literally had someone go in and take out a chunk of muscle in my deltoid, my shoulder muscle, and they didn't find anything significant. It was like in my pursuit of figuring out what the heck was going on. So the muscle loss, sarcopenia, was impacting me, and I'll say I felt it because I was weak and I saw it. I mean, my tissue was just hanging off my bones. I didn't have muscles, but I will say now I'm getting my muscles back. See, bam, bam, bam. And I'm so happy I could do this. I couldn't even flex before. I couldn't make these muscles hard. My biceps were not to be seen. My triceps were just flapping in the wind. And now I'm back. I'm not where I was, but I'm so happy I can flex my muscles and I can lift heavy and do the things that I was not able to do 2 years ago. So again, if I can do it, you can do it. And this is kind of where I want to get into this part of my 3rd part of the story, some of the doctor experiences. And again, my background is in integrative medicine. My dissertation was focused on educating doctors, healthcare providers in a practice, a couple different practices, medical practices, on how to holistically assess their patients, how to listen, how to help remove bias, just subconscious bias before going into and working with different patients, and how to just do a holistic integrative approach. And that was my whole focus of my dissertation. It was founded in the biopsychosocial model. And if you ever are interested, I'll put down below the link to where you could read the dissertation. They're never usually, just that exciting to read. But if you're interested, it's had quite a few hundred downloads at this point. So people are looking now and realizing, some of the things I was focused on 20 years ago are becoming very, very relevant these days, and absolutely relevant with regards to women's health and what we need to do to take care of ourselves. So doctors, again, love ya, but one of my situations revolved around a doctor I saw maybe a year ago. And I was sitting in the office, sitting on the table, and the doctor came in and was doing kind of cursory examinations. And I will say this was for dermatology. I was having some really bizarre rashes a year or 2 ago, and they've subsided, but just strange. I have pictures. Maybe one of these days I'll share all my pictures of my labs and different things, and just ridiculous. I like to document everything. And I was having a conversation about the fact that I was post-menopause and I was having these issues, and if he thought that any kind of topical estrogen, estradiol treatment or cream would be helpful for me. And I said, I know I've been going through, a lot of issues, and I've had a lot of symptoms. I think that are related to my diminishing hormones. And as soon as I said something about diminishing hormones, he's like, oh, well, we don't do that, and everything that you're asking for is aesthetic, and we don't focus on any of these things. And I said, well, yes, but these things are impacting me, and I feel that there may be something going on with regards to my skin and my scalp and my hair loss and these hormone losses. And he just he just looked at me and literally walked out of the room rolling his eyes. And I looked at his assistant, or I would say she looked at me, started apologizing profusely, and said that, you know, there's no excuse. Basically, I can't remember her exact words. She was wonderful. He was ridiculously unprofessional. And that's just one scenario. I've also been in a gynecologist, an OBGYN's office, discussing my issues around my osteoporosis, my low libido, you know, the sex drive, the hot flashes, and discussed that I really would want to, it's before I was on hormone therapy. It's like, I want to get on hormone therapy for all of these things. And she's like, well, we don't treat for osteoporosis. You know, you have to go and see a endocrinologist or another specialist, and that's not my realm. And I'm like, well, it's approved as a secondary treatment for osteoporosis, testosterone. And estradiol is, well, estradiol, not testosterone at the time. So estradiol is approved as a secondary treatment, and I want to get on it and stay on it. And I handed her research from, and boy, I should have had this pulled up, but I'll put it in the show notes. I handed her research from her own society that said, you know, it is used, and I had it highlighted for her to read. And she basically ignored it. She's like, well, this is not how I treat. And I will give you the lowest possible dose estradiol. We'll start you on a transdermal patch, which I was fine with. I'm fine with starting slow. And, you know, the micronized progesterone, she would not even talk about testosterone. What she did tell me was that I probably, if my sex drive was low, I probably needed an antidepressant and a sex therapist. And I'm like, well, I don't think I need a sex therapist, but I mean, to give her credit, that was the first time anyone's ever recommended a sex therapist or anything about sex. And I'm like, well, I'm a newlywed, and there's no problem in my mind with regards to, you know, sex and enjoying it. It's really, my libido went from 100 to 0, 100 miles an hour to 1 mile an hour. And that's not normal for me. And that's what I wanted, the testosterone. But she was just like, nope, I'm not gonna listen to you. And so I was really happy when I went back about 6 months later, after I did see an endocrinologist. And I think in my other video, I talked about the discussion with him. And I was able to convince him with research and stories and comparing, you know, women to men and us needing the same types of hormone therapies as men for low libido. And I was happy to come back and say I really didn't need a sex therapist because I got on the testosterone, and told her, you know, some couple juicy stories about how well it's working for me, which made her as a GYN very uncomfortable, which kind of surprised me. I mean, nothing was graphic. It was just like things are running well, and gave her some details, and she was just like, okay, like she doesn't need to kind of hear that. So those were two, and it was just interesting how doctors can react when you talk about low libido, hormones, you know, anything other than what they're used to hearing, which is probably, I'm having hot flashes and night sweats. But that's just two, in my opinion, small. They could really impact your quality of life, but two small symptoms in relation to the 30 or 40 that a woman could be experiencing. So why are we only treating for a couple things, and why do we as women have to go in and say we're having hot flashes and issues to be treated also for the exhaustion and the pain and the cognitive memory brain problems and all of the other things that these hormones help? So this is our challenge right now. We need to educate our doctors, and it's not just the GYNs and the OBGYNs that need to be treating and looking at this. It needs to be all the doctors, because it's all of our organ systems that are impacted. And it may come down to the primary care doctor being the one to prescribe hormones in the very near future, and then collaborate, as we do in integrative collaborative healthcare, collaborate with their other specialists and your other doctors to let them know. So when your bones do start to improve and your memory does start to improve and you get your muscles back and all of it, the doctors are realizing how well the hormone replacement therapy can work. And also, to have doctors not threaten their patients or female patients with, well, we'll start you on the lowest dose and then in 5 years you're going off of it. That's what I was told. And I'm like, what, wait, why would I go off of something that's reversing my osteoporosis and making me feel 70 to 80% better than I felt in the last 3 years? Why would I even think about going off of it? If my hormones are low and they're getting back up to where they need to be, why do it just makes no sense. So anyway, we're all hoping these guidelines and regulations change. They're starting to change. I am part of that movement. And from here forward, my focus will be on educating women on these myriad of potential health conditions they might have, so they can recognize and are aware within themselves what's going on and can immediately do what they need to take care of it. So educating women, I will have deep dives into about 20 to 25 different specialties going forward, and you'll just be able to search on cardiovascular, heart issues, skin, hair, stomach, GERD, reflux. You'll be able to search on those and you'll get my 15-minute video on those particular conditions. The other piece I'm going to do is I'm going to build out my physician tools and training, so physicians will have resources that, one, they could come to my site and get for free, or two, you could get them and provide them to your doctors and say, this is the current research, these are the current guidelines. I'm not going to sue you. Here's an informed consent. I'm very well educated on the risks versus benefits, and in my mind, the benefits way out impact, the benefits way out impact than the risks that I may have. So getting the woman knowledgeable and prepared for her doctor's appointments is one of my big focus. And you can do like I do, go in, have your conditions listed down, have your choices listed, have the research to back up your choices, and hopefully all of that together will make for a wonderful decision-making environment with you and your provider. So stay tuned for my next videos coming up. They're all going to be educational. I may have shorts depending on if there's little short news things that happen that I really want to get out to you sooner than it takes for me to produce one of these. The other thing I want to ask you is, if you know a woman that you think may help, or a man who's around women, who has sisters and moms and aunts and daughters, please share this information. We are only going to get to that next step of growth and education across the spectrum, across the United States and the world, if we share and keep getting the word out there. And you're starting to see things on the news now, I can imagine. So share with your girlfriends so they're not caught blindsided. And share with those that you love, and like this if you do like it. If you don't like it, then you can give it a thumbs down. But if you do like it, it helps me understand if there is a topic, a subject that you want to know about, or a question you have, just put it in the comments. My next video will be on DEXA. Someone asked about that a couple weeks ago, and I'm circling back, and I'm going to have a deep dive on DEXA to really describe what this is and how that can benefit you. So the DEXA is the bone density scan. And with that, I would like to say thank you for joining. Thank you for listening to my story. I appreciate all of you and all your journeys. I wish nothing but the best for your health, longevity, and health span going forward. With much love, this is Dr. Ange Mack, and I will see you next time.